Today we're going to talk about your heart. Your heart is possibly the most important muscle in your body. It is essential in keeping us alive. Your heart is about the size of your clenched fist and sits in the middle and slightly off to the left side of your chest. Your heart is the pump that allows your blood to carry oxygen and other nutrients around your body. The heart is divided into two halves, left and right, by a wall of muscle called the septum. This helps to keep blood higher in oxygen in the left side of the heart, separate from that lower in oxygen in the right side. There are two chambers in each half of the heart, the upper ones called atrium and the lower ones called ventricles. These are separated by valves that control the flow of blood from the atrium to the ventricle, called the mitral and tricuspid. There are also two more valves, the aortic and pulmonary valves, that control the blood leaving the ventricles. The heart, like other muscles in your body, needs a good blood supply to function. Coronary arteries are the arteries that provide this blood supply for your heart. The coronary arteries wrap around the outside of the heart. There are two main arteries, left and right, that branch off into smaller arteries, providing blood supply to all the areas of the heart. Coronary arteries can become narrowed over time by a fatty material buildup called plaque, causing a restriction in the blood supply to the heart muscle. If the arteries become too narrow, then you may experience symptoms due to the reduced blood supply. This is called coronary heart disease and is the most common form of heart disease in Australia. The symptoms people experience can range from what may seem very minor, such as getting more tired or a bit puffed when doing something. This can be ignored and is often put down to being unfit or getting older. More obvious signs are chest pain called angina. These symptoms may go away when stopping the activity that may have brought them on, or may come more often and get worse over time. Quick management and treatment of these symptoms is extremely important, otherwise they may lead to a heart attack. A heart attack is where a blockage in a coronary artery stops blood reaching the heart muscle. To diagnose a problem with your heart, the doctors may organise a number of tests. These tests can include blood tests, chest X-ray, ECG, stress test, angiogram, echocardiogram, among others. These tests will help the doctors to identify the cause of your heart problem and to decide on the most appropriate treatment for you. Treatment of any heart condition will include identifying and managing risk factors that may have contributed to the heart condition. Medication is also an important part of treatment of any heart condition. Common medication prescribed for people with heart conditions include blood thinning medication such as aspirin or warfarin, blood pressure medication, cholesterol medication, and anti-angina medication. Medical or surgical procedures may be recommended to treat some heart conditions. Common procedures include coronary angioplasty or PCI and stent implantation. This involves a small balloon in a cardiac catheter with an expandable metal stent being inserted through the femoral artery in the groin or radial artery in the arm to open up the narrowed coronary artery of the heart. Coronary artery bypass graft surgery, or CABG, CABG, is open heart surgery where blood vessels are taken from your chest, arm or leg and attached to your narrowed coronary artery to bypass the blood around the narrowed area. Heart valve surgery is surgery to repair or replace a damaged valve in the heart. It is usually done as open heart surgery. Some valves, such as the aortic valve, can be replaced by a catheter method called TAVI, T-A-V-I, for patients who are not suitable for open heart surgery. A pacemaker, or PPM, is a small device that is put under the skin of the chest with wires connecting to the chambers of the heart, stimulating the heart muscle to help it pump regularly. An implantable cardiac defibrillator, or ICD, is a small device also implanted into the chest and connected to the heart by wire leads to monitor the heart rhythm and can send an electric shock if needed to the heart if it is out of rhythm or stops beating. Understanding your specific heart condition and how it is best managed is an important part of your ongoing health care.